A new study shows that nearly a year into the pandemic, many people still don't follow the basic guidelines for protecting themselves against the coronavirus. ABC 10 News reporter Jared Aarons takes an in-depth look at the numbers and why psychologists say it is difficult to get everyone to comply.
We've heard the warnings and the pleas for months. Wear a mask, wash your hands, avoid gatherings. And for the most part, people are. But new numbers show there are still many people who don't. We wanted to find out why.
In many ways, this pandemic is like a perfect storm of factors that lead to poor decision making.
Rachel Blazer is an associate professor at USD's Department of Psychological Sciences. She says the constant changes to coronavirus rules are one reason why some people still don't follow them.
We've been getting these mixed messages for so long, or for very valid reasons, the science has changed, or the regulations are changing.
Regulations like mask mandates, what's open or closed, inside or outside, even whose house you can be at. Keeping track of all of it can get confusing. New numbers from USC's Understanding America study bear that out. 90% of Americans say they wear a mask, and 96% say they wash their hands. But 63% say they've had close contact with people outside their household, and only 49% of those wore a mask while doing so. 15% say they've gathered in groups of 10 or more, with only 47% wearing a mask. And 9% say they ate at a bar or restaurant, with only about half wearing a mask while there. Blazer says those numbers show most people are following the rules. Focusing on them instead of criticizing people who don't could be key to getting everyone on board.
Show that, yes, a few people might not be, but we're all in this together. We're all working hard, and you can join us in doing that.
In psychological terms, it's called the cost-benefit analysis, where people weigh the pros and cons of any decision at a subconscious level. But in a pandemic, the con of missing friends and family or being uncomfortable are immediate, while the pros of staying healthy is abstract.
Maybe in 2 or 3 weeks you might have symptoms. Maybe in 2 or 3 years there might be side effects that we don't even know yet what they are. And that's just not how our brains work.
To change behavior, Blazer says we need to be more consistent with the messaging and also focus on mandates instead of guidelines, because more people are more likely to follow mandates. She also says it's important to focus on the positive reinforcement of coming together to solve a problem instead of criticizing or ostracizing people who don't do enough. Jared Aarons, ABC 10 News.
And if you want to take a look at the study from USC, we have put a link to it on our website, 10news.com. And if you have a story that requires an in-depth look, we would like to hear from you. Send us an email to tips@10news.com.